I represent the good people of Ileluji, Okeigbo, and Okeigbo Federal Constituency from Ondo State. Thank you, Honorable Speaker, for giving me the opportunity to lead the debate for this very important bill. The bill was read for the first time in this Hallowed Chamber on Wednesday, 25th October 2023. This bill is a bold step towards not only addressing the educational needs of the populace, but we also strengthen the primary health system in the country. Mr. Speaker, it is good to know that Ondo State, with population of more than 5 million people, have no Federal College of Nursing and Midwifery in any part of the state. And also, we all know the challenges that we face in this sector, that most of our professionals have traveled outside this country to seek for greener pasture in the Western country, this JAPA syndrome. We know the challenges that this JAPA syndrome has created. Mr. Speaker, if this school is established in Ondo State, at least it will address the massive brain drain that we have in the state, in particular and in Nigeria in general. Mr. Speaker, if we visit some of our hospitals, health centers, maternity homes in Ondo State today, some of the professionals, the so-called professionals that we have there, more especially nursing, the nurses, are the so-called auxiliary nurses or the quack nurses. And this has given the state, it has given the health sector in that state a bad name, because the people are constituent, they don't even have trust in some of the health personnel that we have in the state. Mr. Speaker, if this school is established, it will provide employment for our teeming youth, and also it will provide quality health personnel, more especially nurses in our hospitals, health centers, and maternity homes. It will also address the massive brain drain that we have in our health sector as of today. Mr. Speaker, honorable colleagues, considering the shortage of medical personnel in the country, there is need for the federal government to bridge the gap by establishing more health-related institutions for training of potential nurses and midwives, while also creating an enabling environment with adequate infrastructures and incentives to ensure that Nigeria is not at the losing end. When established the Federal College of Nursing and Midwifery Okeigbo, Ondo State will not only address the imbalance in the establishment and distribution of tertiary institutions in Nigeria, but will go a long way in facilitating educational development and training of potential nurses and midwifery in the state and neighboring states in the country. At this juncture, Mr. Speaker, I humbly urge my colleagues, my distinguished colleagues, to support this bill and give it accelerated passage. I so move, Mr. Speaker. Thank you.
Motion should say aye. Those against should say nay. The ayes have it. Clerk, while reading this, please go back to the 9th and 10th and read for the purpose of our recorder to capture the corrections that we made earlier. Please go ahead.